Hello class, my name is Alex Caruso, and I'm going to be talking to you today about how to greet a patient. This is our second day of clinicals and your second year of nursing school, and so you may be thinking, I already know how to do that. That's maybe one of the few things that I can do, is greet a patient. I have trouble with passing meds or creating a care plan or things like that, but greeting a patient, that I can do. But I think sometimes the simplest things require some of the most thought, and when they're not reflected on properly, that we miss some important aspects of our care. And we know from research that first impressions are very important. For a job interview, we often know that the first impression is when the decision to hire a person is made or not. And we know that these interactions between us and our patients are important, that the providers that make the most mistakes are not the providers that are sued the most for malpractice. It's the providers that don't know how to talk to their patients. So we're going to talk about the simple thing of how to greet your patients. And at the end of this, I'd like you to be able to explain two important aspects on how to do that effectively. So I'm going to do a couple demonstrations, and then I'm going to talk about each. And when I'm done, I will give you a handout for you to reflect on this more, and we'll continue our discussion next week after you've tried this out in clinicals today. Okay, so we'll start with the first demonstration, and I'll just preface it by saying this isn't exaggerated. I see this all the time. So, walk directly into a room, looking around the counters. Ah, there's a mess here. Hey, you're gonna have to clean this up before you leave, man. And the patient's over here thinking, who is this in the room? And they say, as you're about to leave, the patient says, Are you gonna be my nurse? Oh yeah, hey, my name's Alex. Yeah, I'm busy right now. I'll come right back. Right, and that's how I see it done a lot. No intention. A lot of things wrong with it, but I'm going to say that the most important thing that I see missing here, the thing that encapsulates all of the other things, is that the person is forgetting that patients are humans. They are a human with a past, who was born, who had maybe one caregiver, maybe 2, 3, or 4, who was in school and maybe had trouble or maybe excelled, who fell in love or didn't and fell out of love. Maybe they had kids, maybe they had some really hard years, maybe they had some excellent things that they've overcome, some moments of joy and transcendence, a spirituality or not. All of these things, all of these relationships, all of this history is in every one of us. We all have subjective experiences, and in the hospital is some of the worst ones, right? Some of these worries and being poked and prodded and being diagnosed and picked apart is a place where we already feel a bit like an object, like a diagnosis. So it is so important that we, as providers, treat our patients as human, and we start that process as we greet them, right? And I think that this inhuman experience that our patients sometimes get from us, it comes from a place that is not necessarily bad. It is a traumatic experience to be a healthcare provider, to see all of the pain, all of the hurt, all of the diagnoses that are bad, and the poor prognosis, and the death, and the grieving. It is a hard thing to be a part of that, and we naturally build up a shell to protect ourselves. But when that goes too far, it's okay to protect yourself and to not take in all of the suffering around you, but it's not okay to take that so far as that we're not treating our patients as human beings, right? So that starts, well, first let me demonstrate, and then we'll talk about it. Come in. Hello, Mr. Smith. My name is Alex Caruso. I'm going to be your nurse today. I'm so glad to meet you. How are you doing? Right? So it starts in the very beginning with that knock. To treat the patient's room as their room, their space, and not to come into the room before they allow us in, before they accept us in, assuming that's appropriate for the context. And even before the knock, I always take a moment to center myself, to say, this is my time to greet this patient, to enter into their life, and I would like to do that in a way that's intentional and respectful and human. So I take a moment at the threshold to remind myself. I knock at the door. I don't go in till I'm accepted in, treating the space as theirs, not as my space. And then I go directly, I state the name, who I am for them, what my role will be, orienting them to the relationship and the day, and shake their hand, which we would do in any other relationship when we're meeting a new person. These simple acts of respect and simple moments really can change the way that we practice, change the way we interact with our patients. And one more thing I do that's really not part of the greeting is every time I write about a patient, I try never to use the word patient. I try to use Mr. or Mrs. Smith, or he or her or his or him. Just to, again, center myself that they are a person, again, center myself that they are not just a patient, not just a diagnosis, right? Okay, so that's the first thing. Patients are humans. And now I'd say that there's one key, important thing that's missing from this. One thing that we also need to keep in mind. Anyone have a thought in the back? No? The key thing is that you are dangerous. Let me do my third demonstration of how one could greet a patient with that in mind. Getting hand sanitizer after I'm accepted in. Hello, Mr. Smith. My name is Alex Caruso. So good to meet you. I'm going to be your nurse today. How are you doing? Oh, I'm sorry to hear that you're in pain. Before we talk about medicines or anything like that, can I just take a second and look at your wristband? And can you tell me your full name and your birthday? Thank you so much. I just want to do that so that I am making sure I'm in the right place. So I'm going to go and see what I can do about your pain, Mr. Smith. See. And so, in this third demonstration, there are two important things that are added on. Because we often think of ourselves as healers, and we are, as people that are making life better for the patients, that are helping bring them out of the hospital. But what we also need to account for is that we can be great dealers of harm. That preventable medical errors are one of the leading causes of death in the United States, according to the IHI. That these moments that we can cause harm, we might not even know we've done it, right? If we don't wash our hands, or maybe we just sort of real quick do it, and then we give them an illness, and they get septic, and they go to the ICU, and they make it or they don't. These things, it could have been anyone that went into the room, and it's hard to know that it was us. So what we need to do is orient ourselves into these practices, these rhythms that guarantee that we are going to not be the danger that we could be, right? And that starts again with washing your hands, and I know you've heard about this a lot, but it's so, so important to just get in that habit and to not get out of the habit. I think what happens often when nurses become more experienced is they feel like, I got this, I'm doing it right, and I can just sort of do it how the unit does it, how it's done in real life. And we think, wristbands aren't cool anymore, and washing your hands is great, but well, sometimes I'm in a hurry. And I don't want you to be like that. I want you to be safe. Just the other day, I was working with a nurse who had given a patient a medicine that they were allergic to. And it was a big thing. They went into an anaphylactic reaction. Thankfully, we were able to treat it and turn them around. But they did this, and this was a nurse with a lot of experience. And the patient had told the intake person that they were allergic to this medicine. But for some reason, with the computer system, it didn't trigger appropriately. And even though it was in the chart, when the provider ordered the medicine, it didn't trigger an alarm for them. And when the pharmacy acknowledged the medicine, it didn't trigger an alarm. And when the nurse scanned the patient, it didn't trigger an alarm. And it just sort of made it through the cracks. And because she wasn't checking that armband, that allergy, then it caused this big thing. It was super embarrassing for her, and it was dangerous for the patient. So again, you are dangerous. You can cause harm, but if we do the things, these simple things, and keep them a part of our routine, we can find ways to mitigate that danger. Right? Okay. So what I'm going to do now is I'm going to pass out a handout for you to think more about these issues, and we will discuss it more next week. But for today, I'd like you to incorporate this idea of you being dangerous and of you treating your patients as humans into your care today, and to greet your patients well. And next week, we're going to talk about what that was like, and with some things that maybe you thought were helpful, or things that could be more helpful. So I have my handouts here. I'm going to pass them out. Everyone just take one, pass it on. And we have a moment for questions. But if there aren't any, we'll talk more later. Go out there and greet your patients. Thank you for your time.